Hi, folks, and welcome back to Mull. Quite overcast, but dry again. And today's message from Mull is probably going to be one of the shortest you've had, but quite possibly the most important. And today's message from Mull is please don't wait. Now, myself and Katie are currently trying to keep in contact with somewhere upward of 600 folks who have been referred to healthy options in the past, are currently on the scheme, or are future participants who are on the waiting list. And I know some people down in Newcastle as well. Um, and the reason the message is don't wait is that we know at the minute that a lot of folks are experiencing health anxieties around attending their GP practice or visiting A&E or seeking any sort of medical help, to be honest with you, unless it's COVID-19 related. And that's the most natural thing in the world, I guess, at the minute. We know that there's a relatively high risk when we go into those sort of environments if there's other people there with the condition. However, um, there is a real fear that across the world at the minute, not just in the UK, that many people who are suffering with other significant health issues are putting off seeking treatment and putting off seeking advice because of the health anxieties around attending, say, an NHS operation. And that could be really problematic going forward. Because remember, of those upwards of 600 people that myself and Katie are trying to contact, none of them were referred for COVID-19. That will change in the future, and we will be working on rehab programs for people that have contracted this disease, but not at the minute. So there is still a possibility that health conditions will worsen, that new conditions will develop, and it's very important that you seek medical advice for those. Now, you guys know your own body. You will know if something is out of the ordinary. So if it's a condition that is normal for you, and there's no real change, and you kind of expect it, you may have a little relapse, and that's a normal process for you, and you know that you're probably going to come out of that, things will change, then fine, hold off. If you're not sure in any way, then please contact your GP service in the normal way you would. So phone the surgery. The guys there will triage you over the phone, and they will assess whether they think you need to be seen face to face. If you do need to be seen face to face, it will look different. I know some of the surgeries, you turn up, you're handed a mask out of the window, you have to wait, you go inside, you'll probably be the only person there. But still, if you think that you need somebody to look at a condition or talk to your GP, then please do so. Don't just sit and put it off and potentially have that condition worsen. And the same with emergencies. If you think you need to go to A&E, go to A&E. The guys there will talk to you at the reception, and they will make a decision on how best to treat you. If you do suspect you have COVID-19, and remember the symptoms here are a new cough, a persistent cough, and running a high temperature. Now, with regards to cough, if you normally have a cough, then I know that's going to be quite difficult, but basically if the cough worsens, if things change, then phone 111, and the guys there have a specialist service to assess you, and they will give you advice. And I'm going to leave it there, but I beg of you, if something has developed, if somebody in your family has developed a new condition not related to COVID-19, at least speak to your GP practice and get it checked out, because the world hasn't stopped, and health conditions developing has not stopped just because of COVID-19. And stay safe.